Hi, so I'm Dr. Pooja Gala Gogri from Jyotirmay Eye Clinic, and today we're going to be discussing about pirate patches or lazy eye. So what exactly is lazy eye or amblyopia? Amblyopia implies that one eye vision is poor compared to the other eye vision, and this may happen because of a few reasons. Either the child has a glass power which is unequal, or they have a squint, or they have some other pathology in the eye which is not allowing the vision to develop well. Now, how do you pick this up? Unfortunately, the only way you've got to do that is come to the clinic and get your child's eye tested so that we can pick it up in the early period of vision development. Now, the catch here is the critical period of vision development, which happens before 6 years of age. So we expect that you as parents reach us for the first examination before 1 year of age, second examination before 3 years of age, and your third examination before 5 years of age. So your child must have had 3 exams before they enter school so that none of these problems can allow some permanent vision damage to happen for the child, which is lifelong. Once we pick it up, we're going to ask you to treat it. Is it treatable? Of course it is treatable. Now, treating it early gives the best results. What we're going to do is we're going to ask you to close one eye. Now what you've got to remember is you've got to patch the eye which is better. So say that the right eye is lazy, you have to occlude or close the left eye. We ask you to close the eye with a patch which may either be like a band-aid, which is skin color, which is a single time use adhesive material. It can come in a different design or a printed format which has these adhesive stickers which have to be peeled off and stuck over the eye to seal the eye completely. If these are not affordable because they are a single time use patch, you may decide to use simple tissue paper or a facial tissue and medical grade micropore tape, and make sure that you're again occluding the eye fully in this case. And don't forget to use the glasses back over the patient's eye, because it's important for the child to view through the glasses so that he can see clearly and so that the brain now starts using the eye with clearer vision. It's going to be important to remember that children will often not be happy to patch because the better vision eye is closed for them and they are forced to see with an eye which has poor or blur vision. So parents, now is the time for you to be creative. You know your child the best. Engage your child in allowing them to patch their eye with a colorful patch which they've decorated. Stick to a schedule. Give them a sticker or a reward which is healthy after they've done their patching. And make sure that after you remove the patch during the patch hours, you've cleaned the glue around the eye so that the skin does not get irritated and is remaining free of allergy. Sometimes you may decide to change the regimen from a patching regime to giving them some kind of a computer-based vision therapy, which allows the child to wear fancy red and blue glasses like they wear in a 3D movie and play some interesting games which allows different input between a good seeing eye and a poor seeing eye, so that both the eyes' vision develops better, they develop better contrast vision, they develop better depth perception, and their hand-eye coordination can also improve. Lastly, we may sometimes decide to resort to some kind of drops or medication to allow the amblyopia therapy to be more effective in case of poor compliance. Patching remains the gold standard, and which is why it's important to know that you must put in all your effort to patch well. Patching will be given to you in a few hours. Either we tell you to patch for 2 hours, 3 hours, 4 hours, usually maximum up to 6 hours in a day. And this doesn't need to be 6 hours at a stretch. You may decide to do 1 hour at a time, not less than an hour at a time usually. You may use it initially to build it up slowly till your child allows you to patch, but don't take a long time. Get there soon. Make sure that you are making the child do some activity, the child is not falling asleep. Make sure that the child is not peeking out of the patch to look. Make sure the child is not removing the patch, bringing it slightly lower so that they can see with the better eye. and monitor your child when they're going through the patching regime. Lastly, in case your child is young and is really not allowing you to leave the patch on, we may decide to tell you you can just use something to restrain their elbows so that they cannot bend their hands and remove the eye patch. And this could be one of the last resorts we use to make sure that the child has a good vision developing at the right critical age, so that the brain uses both the eyes equally for them to develop better vision, binocular vision, three-dimensional vision and contrast vision in the long term. So happy patching, and hopefully they have strong eyes at the end of this. Thank you.